Question, the member for Cambridge.
Thank you, Mr. Speaker. Good morning. My question is for the Minister of Health. This week, the government gave their thoughts on recent reports that Peel Region and a few other regions in Ontario have implemented or advocated for cruel isolation policies for children, even if the child doesn't have COVID, but someone in their class does. The government's Minister of Health called this policy a, quote, very sensible, without, of course, providing any science or data to justify the comment. Mr. Speaker, would the Minister of Health please explain what part of government telling parents to put their children in solitary confinement as very sensible?
Minister of Health to respond.
Thank you, Speaker, and thank you to the member for the question. No one would suggest that putting a child in solitary confinement is a good idea. No one would. We don't agree with that with the Ministry of Health, and in fact, Dr. Lowe has clarified his remarks to indicate that he didn't recommend that either. That is not something that is good for children. What is important for children is for them to be at school. They need that for their both mental and physical health. That is something that has been our top priority since the beginning, is to make sure that children can be returned to school as soon as it's safe. And that is exactly what we have done. And 99.5% of the cases, all schools are remaining open.
The supplementary question.
Thank you, Speaker. Let me be clear. Any isolation of children is cruel and inhumane. There is nothing sensible about it. While children are less likely to spread COVID, government continues to implement, praise, or avoid condemning such harmful policies like this one, and mandatory mask wearing, and others, all of which negatively affect the long-term health of our children by traumatizing them with fear. My question is, when will this PC government stop negatively affecting the health and mental well-being of our children by putting an end to ineffective policies such as forced isolation, forced distancing, and mandatory masks on children?
Minister of Health.
Thank you, Speaker. Well, as I indicated previously, no one is suggesting the isolation of children for 14 days. No one is suggesting that. No policies are directing that. What we are suggesting and we are recommending, and this has been recommended by all of the 34 Public Health Unit Region Medical Officers of Health, as well as Dr. Williams, that it is really important for children to return to school whenever it is safe. And we've had some interruptions in that when we had a magnitude of transmission in the community. But at this point, schools are open. This is important for children. It is important for them to be in school, to learn, for their physical activity, for their mental activity and their mental wellness. This is what we are recommending, and this is what we are putting forward within the province of Ontario as the best course of action for children.
Thank you.